Hello, Facebook friends. My name is Dr. David Cohn. I'm the Chief Medical Officer and a practicing oncologist at the James Cancer Hospital at Ohio State University. And it's a pleasure to be here today talking about a really important topic, which is related to vaccination for COVID-19, and specifically vaccination in patients whose immune systems may be compromised as a result of a specific condition like cancer. And I think this topic is very timely in light of the fact that Colin Powell, as you may have heard, had died yesterday. General Powell had multiple myeloma, which is a blood cancer we'll talk about for a second, and was vaccinated against COVID-19, and yet that still succumbed from the disease of COVID-19. And I think it's really important to recognize that the plea that I'm going to make is that the reason why Mr. Powell died is not because COVID vaccine was not effective, but that in certain patients, COVID vaccination is less effective. And it's really important in that circumstance that we all are doing what we can do to minimize the risk of getting COVID-19, which includes washing hands, maintaining a safe environment around each other, but also to be vaccinated. And so just for some background, Mr. Powell was 84 years old. Sounds like he was being actively treated for the disease called multiple myeloma, which is a blood cancer that affects the cells which make antibodies. And I'm sure that many of you have heard that antibodies are the cells which are helpful in fighting off infection. And so if a blood cancer affects the ability to make antibodies, then the response to a vaccination may be a lot less than in patients that don't have that compromised immune system whose antibody production is normal. And so multiple myeloma is this blood cancer that reduces the antibodies or the ability to mount an appropriate immune response to any type of vaccination, including COVID-19 vaccine. And also the blood cancer in and of itself makes individuals more susceptible to COVID-19. And so for individuals that are out there that have a condition such as cancer or receiving cancer treatment like chemotherapy or radiation, who your healthcare provider has indicated that your immune system could be weak, or individuals that have some type of an autoimmune disease or on certain medications that can impact your immunity, such as HIV or AIDS. These are groups that have individual susceptibility or more risk for developing COVID-19, and if they were to get it, a much higher risk for becoming severely ill or even dying of COVID-19 like Mr. Powell. And so currently the CDC and FDA have recommended that for patients that are above a certain age, adult patients, individuals should be getting COVID-19 vaccination. And then for those individuals that have some type of a condition that compromises their immune system, they're all eligible for those that received 2 mRNA vaccines, which are the Pfizer vaccine or the Moderna vaccine, that there's actually a third vaccination that's given. And I just want to talk about that for a quick second. It's really important to recognize that this is different than a booster vaccine, which boosters are recommended for people that are older than 65 years old, or for the younger population that might work in a healthcare facility or other jobs that make them uniquely susceptible to COVID-19. But for patients that have a compromised immune system, it's really, really important that that third vaccine be given, because the theory is that because of this immunocompromised immune system or because of the cancer that they have, their body might actually not be able to make an adequate immune response to the first 2 vaccines. And it takes that third vaccination to get them over that edge of being fully protected against severe illness or death from COVID-19. And from what's been reported, Mr. Powell had 2 vaccinations that he got and completed that in February, but he was actually scheduled for his third vaccine at the time that he got ill and was not able to receive it because he was hospitalized and ultimately died before then. So this is a really important message that for those that have a compromised immune system, get out there, get your vaccinations. If you've had full 2 mRNA vaccines, then now's the time to get your third vaccination because you might not be fully vaccinated. So Mr. Powell's death is not a failure of the vaccination itself, because we know that well above 90% of people who get fully vaccinated will not be severely ill or die of COVID-19. That's the outcome that we know works. But it's rather a failure of the vaccine to work in that host. Mr. Powell's immune system was weak. He might have needed that third vaccination to keep himself healthy and protected against COVID-19. And I also want to make one more point before concluding, and that's the fact that it's really important for caregivers of patients whose immune systems are compromised to also be vaccinated. We know that individuals that are in contact with folks that have a compromised immune system, if they were to bring COVID into that environment, those with a compromised immune system could get severely ill or die from COVID-19. So the most effective thing that a caregiver can do besides washing hands and protecting themselves wearing masks and controlling that environment is for themselves to be vaccinated as well. And so we all have a responsibility to ourselves, but we also have a responsibility to our friends, to our loved ones, and to our community at large that we become vaccinated. You speak with your healthcare providers if you're concerned that you might have a condition or a medication that compromises your immune system to ensure that you are eligible for and receive a third mRNA vaccine. And then keep your eyes and ears open for these incredible changes that we're seeing from the CDC and the FDA about the eligibility for vaccinations as well. And so with that, I recommend that everyone be safe, do whatever we can do to keep ourselves healthy. And we're looking forward to getting back to an environment which is going to look a whole lot more normal in the very future. So with that, thank you, everybody, and be well.